what should someone do to start treating their AD?
Probably the first step I would do is look at your medication list, see what you're taking. If you have, like me, hypertension, if you're on some medications for depression, post-traumatic stress disorder, insomnia, anxiety, a lot of those medications are associated with profound decreases in erectile capacity. Some big ones are beta blockers for hypertension or coronary artery disease. Big ones are SSRIs, or selective serotonin reuptake inhibitors, for depression or post-traumatic stress disorder. Anxiety medications like benzodiazepines, like alprazolam, can be associated with erectile dysfunction. So look at your med list, and if you see something, talk about it with your doctor, because there may be alternatives that maybe don't have so much of an impact on erectile function. Particularly with antidepressants and hypertensives, there are a lot of options that have less impact on your erectile capacity.
What advice do you have for somebody who's on medications that cause ED?
That's a big problem. I did a degree in pharmacology when I was in college and in medical school, really delved deep into pharmacology, and as an emergency physician and now as a doctor that works in precision and performance medicine, pharmacology is really important. There's medicines like SSRIs, so those are medicines for depression, and Prozac is probably the first one and most well-known one. That can have a significant effect on ED and can be a big cause for a lot of people. There's other medicines like blood pressure medicines. Beta blockers are one that people take for blood pressure or to slow the heart rate down, and that can be another cause where it's going to affect someone's ability to get a strong erection. So I think a lot of people can help with their depression doing other things other than just medicine. So decreasing their stress, exercise, finding purpose in life, eating healthy foods. When you're eating sugary foods, that kind of increases your anxiety, and then it actually can make you depressed later on when that sugar high goes away. So there's a lot of things you can do lifestyle-wise to help yourself get off those medicines. So there's a lot of people that come in to me, they're on multiple medicines for blood pressure and diabetes, and I really work with them through lifestyle modification. We can get them off those medicines, and that definitely is going to improve their erectile function and sex life and overall health. If you're suffering from ED and you're on certain medicines, let's say a blood pressure medicine, there are medicines that call beta blockers that maybe can affect someone's ability to hold a strong erection. You can discuss with your physician about trying a different medicine. There's other medicines that work on the kidney or different aspects of the blood vessel to decrease blood pressure. If you're having ED and you're diabetic, there's a lot of dietary things you can do to help reverse type 2 diabetes. And you can work with a doctor, and they can maybe change your medicines too as you become healthier and your blood sugar is under control. You can actually get off a lot of those medicines.